This is going to be a little bit shorter than a normal presentation because I've only got, looks like 10 minutes. Can everyone hear me okay? So my name is Nancy. I am from the Student Health Insurance Office. I am physically located downstairs in this building in the lower level near the Counseling and Wellness Office and Student Advocacy. So right below is where you can find me. I'm on campus 3 days a week, Monday, Wednesday, and Friday. So if you need any help or have any questions, that's where I will be. So all international students are automatically enrolled in the student health insurance plan offered by the university. Once you register for your classes, that's going to trigger your enrollment. This year for our spring enrollment, the plan starts on January 13th. So on Monday, you will be covered by the health insurance. If you have not registered yet for your classes, it will take a couple of days after registration to get your enrollment active. If you already have registered for your classes, you might be able to go in and look up your information as of now. Financial guarantees. If you have a financial guarantee through your country or your embassy, you are required to actually physically waive out of the health insurance if your financial guarantee includes health insurance. That has to be done once every academic year. So if that is the case, you can reach out to me and I can give you instructions on how to do that. Okay, so I know that insurance is a little bit different in the United States than it is in your home countries. So this is just a little snapshot of what some of the words mean that you're going to see when you use your health insurance. The premium is the amount that you pay. That is to have the coverage that's going to take care of you while you're here at Wright State. The deductible is the amount that you have to pay for certain services before that health insurance kicks in. That's only for a small amount of services. For example, if you go to student health services on campus, you don't have to pay towards any deductible. But I can get into that. I'll be getting into that in a little bit later. Out-of-pocket maximum is the absolute most you'll ever have to pay during an academic year. Coinsurance is when you go to a doctor, the insurance pays their portion and you pay your portion. Copays are a fixed amount that you would pay if you see a specialist. Okay, and because I'm short on time, I am going to do this pretty quickly. Like I said, you can always reach out with questions if later. So our in-network coverage details, the deductible is $500. It sounds like a lot, but a lot of plans have deductibles that are up to $10,000. So this is a really good amount to have a deductible. These are the prices that you will run into when you see certain individuals for healthcare. Student health services, again, is no charge for preventable and acute illnesses and minor injuries. Okay. Well, I'm just going to tell you where to go to care. Services that can be accessed at the Student Health Center are like sick visits, you don't feel well, vaccinations, prescription refills, birth control, testing, and more. You can make an appointment by calling this number up here, and they are available 5 days a week. If you don't have a car, there is a shuttle that you can look up on wright.edu for the Raider ride. So the Student Health Center is going to be the least expensive place to access care at all times. The next level is an urgent care for fractures, wounds requiring stitches, a sprain, or strain. Emergency rooms here in our country are for emergency, life-threatening only. You wouldn't want to go there if you have a sore throat, right? You'd want to go to an urgent care or you'd want to go to the primary care or student health services. We also have, which you can see this little emblem up here, the Live Health Online. That is a telemedicine visit that you have with a provider, and that is at zero cost. So if you have an illness going on that you feel that you can't get an appointment soon enough for, you can put this app on your phone and you can consult with a doctor at no cost. I just used it recently and it was really effective. This is our app. This is what the little icon looks like. This is the Anthem app that you can put on your phone once you're registered. So if you want to look for this app on your phone, it's called Sydney Health, and you'll be able to access your membership ID card, your benefits, your explanation of benefits, and everything that you could want to see. Okay, there is my contact information at the bottom. That is the student health insurance Wright at wright.edu email. If you have any questions whatsoever, you can email me and I will get back to you as soon as possible. The other phone numbers there are for Anthem. To get your card, to actually get your membership ID card that you can use at the doctor, you want to create an account at anthem.com. It's ANTHEM.com. You want to create an account, and then you can have access 24/7 to your membership ID card. I do not get the membership ID cards. I do have a lot of students who come down and request that I hand them their card, but I don't get those. Once you're registered and your plan is active, you can call this number for at enrollment and eligibility, confirm your mailing address, and they will mail you a card if you want a physical card. You don't need a physical card because if you have the app on your phone, that's all that's necessary. That is a nutshell. A lot of information. I don't know. Does anybody have any questions, like quick questions? Okay. Well, welcome to Wright State. Hopefully you'll enjoy your time here. You got a lot of snow to welcome you.